Welcome back to the Last Visit First podcast, live from Scottsdale, Arizona at the Phoenician Hotel, Lincoln Group's conference called Homecare 100. I have Si with me. He's the CEO of CareXM. Welcome to the podcast.
Thank you. Thanks for having me.
Why are you here?
Well, I'm always here to connect with the community overall. This is actually my, I think, number 6 Homecare 100. Carla Davis, introduced me to the community overall. Been falling in love with this close connection with everyone and just the simple ability to learn what this really close-knit community is up to and how to improve the care together. And that's been very rewarding every single year.
It's pretty awesome to be here. And this is my 21st. 21 times I've been here. So there's only had 23 of them. I missed 2.
Yes, everybody does tell me Tom's one of the originals. That's probably why.
It's been a long time. And it's fun. We actually, Jen and I have 10 companies we represent here. So it's a blast. Super excited. Tell us about your business. What do you do?
Yeah, so our business is mainly focused on a technology-enabled triage capability for large-scale home health and hospice providers. We work with the Medicis, LHCs, and Gentivas of the world, as well as some of the mid-sized and fast-growing agencies. Our goal is to really give them the capacity to run clinical triage first in the after hour and give them a set of tools so that they can understand all the different opportunities to improve the efficiency, because the only reason why you would interact or utilize the after hour interaction a lot is potentially some missed opportunity during the day.
So you're really making a home health or hospice agency a 24/7 agency.
Absolutely, because increasingly so, especially with the HOPE assessment impact, you want to pick up everything that happened during the day with some thematic sort of trail that you follow as well.
And you guys have your own technology, or are you just logging into the EMRs? What are you doing?
Yeah, we took a very deliberate approach. This happened on a founder's insight. So I've joined the business about 3.5 years now. He always had the vision to say, let's not let many people log into all the disparate EMR. It'll slow things down. It'll create HIPAA sort of compliance exposure. We very intentionally build an overlay stack that allows us to bidirectionally integrate with the Homecare Homebase and MatrixCares of the world so that we can truly centralize our workforce and be able to have nurses pick up phone calls from any one of the states without regard for individual login for the EMRs.
Did you see that airplane flying around yesterday? It said, no EMR.
That was quite the stunt.
You don't
that
need
was
the
quite
EMR.
The stunt.
I don't know whose it was. So they didn't
I don't know what it is.
It wasn't mine, by the way. So Luke Rutledge, Tim, it wasn't mine. But yeah, I was like blown away. Like when it first started flying around, I had to pull out my rangefinder on the golf course to figure out what it said. It said, you no longer need an EMR. I'm like, well, you really do, because you got to bill and schedule and all those things.
Yes. Well, with the apparatus that you put in from early part of your career as well, the compliance and the revenue cycle piece is such a lifeblood. It's very, very hard to replicate.
No EMR would be weird, but it was wild. Who's here with you?
I'm here with the whole team. We have our Chief Growth Officer, Steve Molinari, whom you know, and half of our sales team and some of our marketing team as well.
Oh, that's great. Yeah. You guys are one of the premier sponsors, so I'm sure Lincoln loves that.
We've learned to really kind of continue to stick with it every single show, and that has really brought a ton of reward, right? Not only are we sort of having access to all the right partners, we start to really learn a lot about how this community functions.
Yeah, it's I always tell everybody I've sold more software at this conference and made more relationships at this conference than any other conference. It's by far the premier, and we always look forward to it. Of course, we love it when they host it in Scottsdale, because I live in Scottsdale, so I don't have to travel.
Yeah.
Just drive up from my house, but it's great. What have you learned while you've been here?
So far, of course, this is sort of first date. Of course, we had the weekend program overall. I think this does feel like the year where everybody is, I would call AI curious, and then also sort of growth constrained a little bit, right? Demand seems to be the perennial, but how do you sort of overcome the capacity constraints in order to capture those growth? Lots of thinking about different models of growth. What are the rate limiters to that? And what role does data really play? What's inside the EMR? What's outside the EMR?
Yeah, interoperability was a big theme this morning. Communication was a big theme. I don't know if you're in the room when they were doing these patient examples. That was really interesting to me. A lot of things are challenging around those patients. And if you've ever had the experience, like my mom was on LHC, took care of her, but it took a little while to get her admitted because of her insurance and all that. And it wasn't LHC's fault, but they couldn't get authorization. And so she got out of the hospital. It was 4 days before she really got, care started. This isn't good. When you have a hip replacement surgery, 4 days sitting there doing nothing and wondering. And so I always think about that. How do we make that better? And there was a lot of conversation around that this morning. It's pretty good. And then I think interoperability, everybody's talking about AI, ambient listening. How do we document faster? But interoperability is going to be a big piece of it.
Yes.
How do we get data in and out of these systems? And everybody needs to open their systems up and do it in a compliant, friendly way. But we got to do it. It was a great show. I think it's been amazing. I'm looking forward to day 2. Anything you want to tell the audience?
Yeah, and I'm just excited to be a continued part of the community and have the opportunity to serve all our client partners and soon to be partners as well. We're big believers in unlocking the clinician's capacity at the very front line. And we're inspired by some of your work as well in order to really truly focus on innovating with the very front line. Because I think, talk about interoperability, fragmented experience, this industry has such a large distributed workforce and so many moment to moment interaction that's tribal instinct, clinician knowledge. How do we help them capture all of that context and make it actually useful so that the moment by moment decision are directed to those who really need it and allow you to scale going forward from that? I look forward to learning from everyone about that too.
Cool. How do they reach you if they want to find your business and you?
You could go on carexm.com on our website or on LinkedIn profile. We're pretty active in all channels as well.
Okay, and we'll have Cole post those in the show notes so everybody can find you there.
Thank you. I appreciate that.
Thank you for being here.
Thank you.